The important thing that will come in our exam is management. A patient has come to you with paracetamol poisoning. Now what we will give to this patient as a treatment? The most important one is serum paracetamol level at 4 hours post ingestion, not post admission. There is a staggered overdose. That means the patient has taken the above limit of paracetamol at a staggered dose. Then the next topic is paracetamol overdose. That means paracetamol poisoning. We have done this paracetamol poisoning in other chapters too, but in emergency chapter we will discuss this more briefly. Okay? Risk factors. The patients who have some risk factors for paracetamol poisoning. What are those? Patients who take liver enzyme inducing drugs like rifampicin, phenytoin, carbamazepine, chronic alcohol intake. Okay? Malnourished patient like anorexia or bulimia, cystic fibrosis with hepatitis C, alcoholism, HIV. Patients who have not eaten for a few days. These are some risk factors for paracetamol poisonings of the patient, but there is nothing like category like if the patient has more risk factors, so there is some other criteria to the treatment. It's just some risk factors, no criteria is divided. The important thing that will come in our exam is management. A patient has come to you with paracetamol poisoning. Now what we will give to this patient as a treatment. Okay? On admission, we'll have to do some tests, certain investigations. What are those investigations? Full blood count, urea and electrolyte, liver function test, INR, blood gases and glucose. Okay? These are the investigation we'll have to do whenever a patient, any patient will come to us with paracetamol poisoning. Okay? Plus, the most important one is serum paracetamol level at 4 hours post ingestion, not post admission. That means a patient has taken paracetamol on 12 p.m. and has come to you at 3 p.m. Okay? So, you will do this serum paracetamol level at 4 p.m. That means 4 hours post ingestion, 12 to 4. This 4 hours ingestion of level of paracetamol, we will take the sample and do this level. Okay? Not like patient has come 3 p.m. at the hospital, so 4 hours after, so 7 p.m. No, this is not the right method. After the ingestion, the time is always count from the actual time of injury. And after seeing this level, we will decide whether this patient is needed IV acetylcysteine or not. Okay, the antidote of paracetamol poisoning. So what are the indications? So what are the indications of IV in acetylcysteine? This antidote in acetylcysteine should be given in IV route. That's why we're telling this every time like IV in acetylcysteine. So what are the indications? The first one, there is a staggered overdose. That means the patient has taken the above limit of paracetamol at a staggered dose. Okay, like ingestion of 6 gram. That means 12 tablets each day for 5 days. This is an overdose. The normal dose is a person can usually take highest 4 gram per day. Okay, 4 gram of paracetamol a patient can usually take highest number in a day. This patient has taken 6 gram. Okay, 6 gram of paracetamol, but each day for 5 days. That means every day this patient has taken some amount of paracetamol, and he or she has continued this amount for 5 days. That means the dose is low, staggered, but he has consumed it in the 5 days. So we can call it as overdose. So what is the indication? There is a staggered overdose. This is very important. If the patient has taken staggered overdose, then it's called paracetamol poisoning. There is doubt over the time of paracetamol ingestion, okay, regardless of the plasma concentration. That means a patient has come to you at hospital like at 3 p.m. okay, and we have done after 4 hours, we have done the paracetamol level, but patient cannot actually mention in which time he or she has taken the tablets. So we are not sure about the time. So whenever the patient has come to us after coming to us 4 hours, or immediately if we do the paracetamol level and it's still within the normal range, still we will have to give IV in acetylcysteine. Why? Because we do not know about the time, we are not sure. So we'll have to give it. Patient presents more than 8 hours after ingestion, then we'll have to give the antidote. Jaundice or liver tenderness, that means the patient has already developed jaundice or liver tenderness. Patient is unconscious or have a suspected overdose. 4-hour ingestion plasma concentration level of paracetamol is on or above the treatment line, okay, regardless of the risk factors of their hepatotoxicity. That means patient has come to you after the ingestion of the 4 hours, we have done the paracetamol level concentration and it is on or above the treatment line, then we will have to give the antidote of paracetamol poisoning, that is IV in acetylcysteine, okay. Now, patient has come to you after ingesting 30 tablets of paracetamol, okay, that means 15 gram, but without any other indications for initiating in acetylcysteine. So, a patient has come to you, he or she has ingested 30 tablets of paracetamol. Now I have come to you, we have done everything, we have checked everything, there is nothing to do. I mean, there is no abnormality we could found in the results. So what we will do? We will measure the paracetamol levels at 4 hours post ingestion. We have done it and it's also normal. Then what we will do? We will refer the patient to the psychiatric team, because a person who can eat 30 paracetamol tablets, that means he or she has attempted suicide, okay. So for this purpose, medically, in medicine world, we do not have to do anything, because we have done post ingestion paracetamol level at 4 hours, we have found it normal, we have done other investigation profile, they are also normal. So in medicine world, we don't have anything to do like remain. So we'll have to refer the patient to the psychiatric ward now, because this patient might need some psychiatric counseling because he or she has attempted suicide, okay. So usually treatment is given in medicine ward, but if the treatment of the medicine ward is finished or there is nothing to do in the medicine ward, then we will refer the patient to the psychiatric ward, okay. Now the critical dose of paracetamol is 150 milligram per kg in 24 hours, that is approximately 24 tablets, that is 12 grams, okay. So this is the critical dose. The critical dose is 150 milligram per kg in 24 hours, okay. If the patient presents to you more than 8 hours of paracetamol ingestion, we have already told you that we'll have to commence in acetylcysteine. But if the patient has come to you within 1 hour after ingestion of more than equal to 150 milligram per kg paracetamol, then we can give oral activated charcoal, that is 1 gram per kg to this patient, okay. Maximum we can give 50 gram, okay. This is the treatment.